For Achilles tendonitis, surgery to remove the bone spur is rarely a necessary treatment option. More often, non-surgical treatment is the best choice to alleviate your symptoms.
In general, we want to treat Achilles tendonitis very aggressively in terms of rest, ice, compression, and elevation. Those are the things that we want to really start with because those really help reduce the inflammation. Achilles tendonitis is not something that we can just put a cortisone injection in and get a quick result and you're back on the field. You need to stretch, you need to work with a physical therapist. In general, I find that you need to work with a physical therapist because doing it on your own can be painful and it could limit your ability to get better. You want to have somebody who's trained who's going to help you along with this process. So I find physical therapy to be a really great tool for recovering from Achilles tendonitis. Wearing heel lifts, using an orthotic device, which is a long-term for an arch support that we make for you to correct any abnormal ways that you're walking that might be making it worse. In general, we start with the heel lift because that's something we can dispense right away. The heel lift is just a thin piece of, we just use a felt piece that you can put underneath the heel of both your shoes so you don't fall, so you're not lopsided when you walk. And in general, this just lifts up the Achilles tendon, lifts up the heel, and takes pressure off of it. So when you walk, you don't have to hit the ground so far. This is an orthotic device or an arch support, and you take the liner out of your sneaker and you put it right into your shoe. And in general, what it does is help to take pressure through the whole time that your foot is on the ground. So it gives a lot of pressure relief. It holds up the heel, it holds up the arch, so it minimizes pressure with each step that you take. And so the Achilles tendon can actually heal and pressure can be relieved for that tendon. Achilles tendonitis rehab commonly takes about 3 to 6 months to fully rehab an Achilles tendon, and that's to where you're back to doing everything that you want to do again. There will be limitations in what you do for the first at least 6 weeks because rest is a really important component of Achilles tendonitis resolution. You really want to make sure that that tendon heals properly so you don't have any injuries long term.
The main goals of physical therapy for Achilles tendonitis are to develop a home exercise program and a treatment plan to specify the needs of the patient, whether it's a biomechanical issue, a flexibility issue, or a strength issue. Determine the source and the cause of the tendonitis. The causes of Achilles tendonitis are typically an overuse type injury. People who exercise and increase the intensity and duration at a quick pace rather than a gradual increase in exercise develop more of the tendonitis. It can also be a biomechanical issue, whether the placement and the shape of one's foot puts the ankle at fault. So one of the most common treatment techniques that we tell people to do at home for Achilles tendonitis is to stretch their gastroc and soleus, or their calf muscle. Your calf muscle is made up of 2 separate muscles, one the gastrocnemius, the second is the soleus. The gastrocnemius crosses the knee joint, so when we stretch that muscle, your leg is going to be straight. The opposite is true for the soleus. We're going to do that one with a bent knee, okay? So I tell most people to do this stretch at home against their wall. We're going to get you to stand up. Okay. And I threw a towel down here on the floor. The reason I have the towel on the floor is you're going to step on it in a way so that the Achilles and the arch is supported, the natural arch in the bottom of the foot is supported. So with your left foot, I'm going to have you step on the towel so that the front corner of your foot, kind of like a postage stamp, is on the towel. Your right foot is going to come forward, and your hands are going to be placed up against the wall. What you want to make sure, when you look down, you want your toes to be lined up directly pointed towards the wall and not rotated out at all, okay? As you gently push against the wall, you're going to feel a stretch right up the back of your leg and down into your Achilles tendon. I tell most people to hold this stretch 20 seconds, and you're going to repeat it about 5 times. Okay. The second stretch is for the soleus muscle. This muscle does not cross the knee joint, so we're going to take the knee out of the picture. Typically, I will now move the towel up, and your leg is going to become the front leg. So you're going to step on the towel the exact same position. And now your front leg is going to lunge towards the wall. You want to maintain contact of your heel with the ground, and your knee is bent slightly towards the wall until you feel a pull in the back of your leg. Again, you want to hold this 20 seconds and repeat 5 times. Pronation of the foot is typically the inward and downward rotation of the ankle and foot complex when you take a step. This is a natural response to any gait pattern. However, some people overpronate, which puts stress on the ankle. There's also the opposite, underpronation, where they're not pronating enough. So when we assess the structure of the foot, we're looking at an arch, whether a person has what's considered a normal arch or too flat or too high of an arch. In this case, the patient has a normal arch. We look for the orientation of the Achilles tendon, whether it's in a vertical position. Additionally, somebody with too low of an arch, the foot will bulge to the inward step and you'll get a C deformity of the Achilles tendon. The reverse of that, too high of an arch structure, the Achilles will kind of bulge to the lateral aspect. This is going to change the alignment of the calcaneus bone, which the Achilles attaches to. The progression of therapy starts off at the impairment level. We look at flexibility and strength as the source. We will educate the patient on self-stretches and strengthening. If the patient is athletic or sports-specific, we will advance them to those type of agility exercises. We will have them doing box jumps or ladder drills to not only strengthen the tendon, but also get them back to their prior level of function and recreational activities. Footwear and Achilles tendonitis are very closely linked. A properly fitted shoe can decrease the likelihood of developing Achilles tendonitis. It can also assist in the recovery process and the prevention of reoccurrence of the injury. Improper shoe wear can increase the likelihood and reoccurrence of a tendonitis.
Achilles tendonitis is a preventable injury. Taking a few simple precautions can help you avoid this condition. You can begin by checking the alignment of your foot. While there are many high-tech, expensive ways to evaluate your arch and whether you're flat-footed, first try this simple approach. I call it the wet foot test. Step in some water with your bare feet and then step on dry pavement or cement. Your wet foot leaves a print of the weight-bearing surface of your foot. A normal pattern shows your heel, the outer edge of your foot, and the forefoot or the front of your foot. The inside of your arch should not leave a print. If you have a high, rigid arch, then the pattern shows your heel, less of the outer edge of your foot, and a smaller portion of the front of your foot. If you're a flat-footed or overpronate, you'll show a whole footprint. Knowing the alignment of your foot can help you determine if you are more at risk for developing Achilles tendonitis. If you do suffer from Achilles tendonitis, try using arch supports. It can significantly reduce the stress placed on your Achilles tendon. If you're unsure of what type to choose, ask your podiatrist or orthopedic surgeon, and they can guide you. Even some specialty running shoe stores can assist you in finding the correct combination of proper fitting shoes and orthotics to suit your gait pattern and your foot alignment. And finally, always remember to stretch. You have to do a proper warm-up prior to beginning any physical activity or workout, especially if you have Achilles tendonitis. This is an essential, often overlooked part of any workout. Stretch and loosen the tissues. This will allow you to better absorb force in whatever activity you choose to participate in. And that's the art of medicine.